Most people never realize their sleeping position can quietly raise stroke risk. When your head or neck bends, blood flow to the brain drops for hours without pain or warning. Oxygen falls, circulation slows, and small clots may form. As a neurologist, I have seen many patients harmed for years without knowing. Protecting your brain starts with how you sleep. If you wake up dizzy or foggy, it is not just aging. It often means your brain did not get enough oxygen at night. Poor sleep posture can narrow your airway or compress neck arteries, creating long periods of low oxygen even after 8 hours of sleep. This leads to confusion, headaches, and sluggish mornings. These are warnings about nighttime blood flow, and simple position fixes can reduce them. When your neck is twisted or sharply bent during sleep, the arteries carrying blood to your brain become partly compressed. Like pinching a hose, blood flow slows and becomes turbulent, increasing clot risk, especially in older adults. Even small reductions in flow place the brain under oxygen stress for hours, harming cells and raising stroke risk. Proper neck alignment is a simple but powerful way to protect your brain. Most strokes occur during sleep, the silent stroke window. At night your blood pressure shifts, breathing slows, and the brain depends on steady circulation. If your neck twists or your airway narrows, oxygen quietly drops and can trigger small strokes over time. What seems like forgetfulness may be damage from poor nighttime blood flow. Fixing sleep alignment helps protect the brain when it is most vulnerable. Some sleep positions sharply raise stroke risk because a wrong neck angle narrows the airway and brain arteries. As muscles relax, these vessels are easily compressed, reducing oxygen, destabilizing blood pressure, and increasing clot risk. Older adults are more vulnerable. This video will help you spot harmful positions and make simple adjustments to protect your brain. Morning headaches are often a sign of poor nighttime circulation. When sleep posture blocks airflow or compresses arteries, carbon dioxide rises and the brain expands its vessels, creating pressure and pain. Many treat the symptom, not the cause. Correcting posture keeps the airway open and oxygen stable, reducing recurring headaches and helping you wake up clear and refreshed. Sleeping on your back may work for younger adults, but for seniors it can reduce airflow. As throat muscles weaken with age, the tongue can fall back and partly block the airway, causing oxygen drops and snoring. Even quiet airway collapse strains the heart and harms brain circulation. Avoiding unsupported back sleeping is an important step for long-term brain health. A pillow that is too thick or firm can push your chin toward your chest, bending the neck and compressing arteries that supply the brain. Many seniors blame stiff necks on age, but poor pillow design often reduces blood flow for hours. A proper pillow should support the neck's natural curve. When alignment is correct, circulation stays steady and the brain remains protected during sleep. Sleeping on your stomach forces your head to twist sharply, stretching and compressing the carotid arteries that supply blood to the brain. Hours in this position create unstable flow and higher clot risk. Even if it feels comfortable, it also strains the spine and reduces oxygen. For older adults with less flexible arteries, it is especially dangerous. Avoiding stomach sleeping is critical for brain health. When your neck and spine fall out of alignment during sleep, blood flow to the brain can drop without causing pain or waking you. The brain experiences silent oxygen loss that, over time, accelerates memory decline, reduces clarity, and raises stroke risk. Older adults with stiff arteries are especially vulnerable. Correcting sleep alignment helps maintain steady circulation and protects brain health. Side sleeping can be safe only when the neck and spine stay aligned. Many seniors use a pillow that is too low or too high, tilting the head and reducing blood flow. Proper alignment keeps the airway open and arteries free of pressure. A pillow should fill the space between shoulder and ear so the head stays level. Adjusting pillow height is an easy way to protect brain health and keep oxygen stable at night. Sleeping with your chin tucked toward your chest may feel comfortable, but it narrows the airway and reduces oxygen flow. As the chin drops, the throat compresses and relaxed muscles can let the airway collapse. This position also pressures neck arteries, keeping the chin neutral, as if holding a small ball under it, helps maintain airflow, protects circulation, and reduce morning fatigue and headaches. Many seniors stack multiple pillows for reflux or breathing, but too much elevation pushes the chin forward and sharply bends the neck. This compresses arteries that supply the brain and reduces circulation for hours. It also strains the spine. If elevation is needed, raise the entire upper body with a wedge or adjustable bed. Stacking pillows creates harmful angles. Proper alignment protects the brain from oxygen loss. Sleeping with one arm under the pillow lifts the shoulder and tilts the neck, compressing arteries on the side of the neck. This angle can also stretch nerves and cause numbness or tingling in the fingers. Many people wake with a dead arm without realizing the cause is poor alignment. Avoid using your arm for support and choose a pillow that provides proper height. This helps protect circulation and reduces morning symptoms. Sleeping with your mouth open signals airway narrowing. As the airway tightens, the tongue and soft tissues vibrate, causing snoring. Snoring is a warning that airflow is unstable and oxygen may be dropping. Repeated drops raise blood pressure, stiffen arteries, and increase stroke risk. Side sleeping with proper pillow support can reduce mouth opening, keep breathing steady, and protect long-term brain function. A sagging mattress forces the spine into an unhealthy curve, twisting the neck and hips and creating pressure that can compress nerves and blood vessels. Poor support reduces nighttime blood flow. Yet many seniors use worn mattresses for years. A medium firm surface helps maintain natural alignment so arteries stay open and circulation remains steady. Morning stiffness often signals that your mattress is no longer supportive. Twisting your legs in opposite directions while sleeping rotates the hips and lower spine. This rotation can travel upward, misaligning the neck and placing subtle pressure on arteries that supply the brain. It may also strain the lower back. Keeping the knees stacked with a pillow between them prevents twisting, reduces hip pressure, improves sleep quality, and helps maintain healthy nighttime circulation. Some seniors sleep with scarves or heavy neck wraps to stay warm, but thick layers can restrict movement and push the chin downward. This reduces airflow and may compress the arteries in front of the neck. The neck should rest freely in a neutral position. If you feel cold, warm the body with blankets or room temperature instead. Keeping the neck uncompressed supports healthy breathing and steady brain circulation at night. Sleeping with an arm raised above your head stretches shoulder nerves and reduces blood flow to the arm and neck. It also rotates the chest and can shift neck alignment. Many people wake with numb or heavy arms because circulation was blocked for hours. Keeping arms relaxed at the sides or supported with a small pillow helps prevent this. Protecting arm circulation also supports healthier blood flow to the brain. A pillow that is too low makes the head tilt downward, bending the neck and placing pressure on the vertebral arteries that supply the back of the brain. This quiet reduction in blood flow can lead to dizziness, stiffness, or blurred vision. The head should be level with the spine. A properly sized pillow keeps the neck lined, improves circulation, and supports healthy oxygen delivery throughout the night. Sleeping near the edge of the mattress can leave part of the shoulder unsupported. When the shoulder hangs off, the neck tilts and the spine rotates, creating uneven pressure on arteries that supply the brain. Many seniors wake with neck discomfort or arm numbness. Sleeping centered on the mattress provides full support, keeps alignment stable, and helps maintain healthy nighttime circulation. Some pillows flatten under the head, leaving the neck unsupported. When the neck angles downward, the airway narrows and oxygen flow drops. This strain can cause snoring, dry throat, and mild breathing interruptions. A proper pillow should keep the neck neutral all night. If your pillow loses shape quickly, replace it with a medium firm option to improve airflow and protect brain circulation. Pressing a hand under the jaw during sleep creates upward pressure on the throat, narrowing the airway as throat muscles relax. This can cause repeated oxygen drops, leading to morning headaches, dry mouth, and fatigue. Keeping hands away from the jaw helps the airway stay open. A small pillow in front of the chest prevents the hand from rising and supports steady breathing throughout the night. Curling the legs tightly toward the chest may feel comforting, but it compresses the abdomen and restricts the diaphragm, leading to shallow breathing and reduced oxygen. This can stress the brain during deep sleep. Seniors who sleep curled up often wake tired. Keeping the knees slightly bent and allowing the chest to open naturally helps the lungs expand and supports healthier nighttime breathing. A pillow that is too low can make the head tilt backward, stretching the throat and collapsing the airway. This reduces oxygen and strains the neck. putting pressure on arteries at the base of the skull. Many seniors wake with dry mouth or stiffness from this posture. A pillow should lift the head slightly while keeping a natural neck curve to improve breathing and protect the brain at night. Sleeping without a pillow can create a sharp downward bend in the neck, compressing arteries that supply the brain and stressing the vertebrae. While it may suit some younger people, it often causes circulation problems in seniors. A pillow that lifts the head just enough to keep the neck straight is safer. Proper alignment keeps the airway open and supports steady oxygen flow throughout the night. Heavy blankets may feel warm, but they press on the chest and limit deep breathing, reducing oxygen intake and lowering the brain's oxygen supply. This is especially risky for seniors with weak lungs or heart issues. Using lead-lighter blankets keeps warmth without restricting movement. When the chest can expand freely, breathing stays smooth and oxygen remains stable throughout the night. A mattress that is too soft lets the hips sink below the shoulders, creating an unnatural spine curve that can misalign the neck and compress neck arteries. Many seniors wake with stiffness or a heavy head from this posture. A medium firm mattress keeps the body level, supports alignment, and protects circulation. When the spine stays straight, blood flows freely to the brain and sleep is deeper. Frequent tossing and turning twists the neck and disrupts blood flow. Seniors often move because their mattress or pillow does not support them well. Poor support forces the neck into unstable angles, creating brief drops in brain oxygen. Improving mattress firmness and pillow alignment reduces the need to shift positions. When the body feels supported, sleep posture stays stable and circulation remains healthier. Resting your head on your arm compresses nerves and reduces circulation to the hand. It also forces the head and neck into a downward angle that strains the cervical spine and limits blood flow to the brain. A pillow supports the head evenly, but the arm does not. Using a proper pillow keeps the neck lined, reduces shoulder stress, and supports healthier sleep posture.